until we start. Brilliant. Well, let's make a start then. So good afternoon and welcome everyone to Crossriver Partnership's 15th live share session, which today falls on Human Rights Day. I hope everyone's keeping well. So my name is Thomas Joyce. I work here at Crossriver Partnership, and over the next hour or so, we'll be discussing the right to clean air, protecting and empowering communities. So this live share will provide deeper insight into air quality, highlighting some of the programs and initiatives that are currently underway within the capital to help address the health impacts caused by poor air quality. But before we make a start, a few bits of housekeeping that I would like to mention. So this live share session is being recorded and will be available to view online. Like always, we'll signpost you to the link for this at the end of the event. Also, I know that you'll be able to see that there's only just one person watching, and you might be thinking, is it only me? Please don't worry, you're not alone. I can assure you that there is more than one person watching this event. Also, we would like to mention that to ensure a smooth experience, we're just going to keep to our headshots for this live share. And on the note of smooth experience, do make sure that you've logged on via Google Chrome, as the live webinar platform works best using this browser. And just a little bit of tech wizardry for you all. If you would like to make the chat function at the bottom right-hand corner of your screens larger, simply press the arrows in the top right-hand corner of the attendee list and speaker list to minimize them, making them slightly smaller. So brilliant. So during today's live share session, we'll be joined by a number of experts from across the industry. These include Matt Towner, Portfolio Manager at Guy's and St Thomas's Trust Charity, Grant Waters, CEO and acoustician at Tranquil City. I will also be joined by Ben Warren, a CEO and air quality expert at Tranquil City, Abby McDougall, Technical Project Officer here at Crossriver Partnership, myself, Crossriver Partnership. And then we'll also be joined by Anusha Rajamani, a Project Officer here at CRP, and she'll be moderating the chat facility on the right-hand side of your screens. I'll come back to that feature in just a moment. And also Rachel Aldridge will be our tech lead for the session. So during today's live share session, we'll firstly provide you with a brief introduction to CRP in addition to some of the projects we work on. We'll then move over to Matt Towner from Guy's and St Thomas's Trust Charity, who will be talking more about the health effects of air quality, in addition to some of the projects they are working on. We'll then be joined by Grant Waters and Ben Warren, from Tranquil City, in addition to Abby McDougall from our very own Clean Air Villages 3 programme. Grant, Ben and Abby will delve into some of the monitoring work being undertaken as part of the programme, showcasing some of the results. And then finally, we'll have a final discussion or observation for all of our speakers to provide their thoughts and views on, to see how we can all work together to improve air quality. During the live share, there will be a chance for you to have your say via a Q&A session after each presentation. As I've mentioned, Anusha will be moderating the chat to the right-hand side of your screens. So please do ask your questions in there during the presentations, stating your name and where you're from. We'll try our very best to answer all of your questions, but if we are unable to due to time constraints, then please do contact us via email and we'll get back to you with a response. Our email addresses will be displayed at the very end of the session. So before we make a start, we would like to pose a question to you, the audience. And this question being, have you noticed any changes to traffic patterns within your local area since the first national lockdown? So have you noticed whether they've increased or decreased? As a result of this, have you noticed any change to potentially your local air quality? So we know that you might not be aware of the exact pollutant measurements, but do tell us what your perception might be. So do you feel like your health has improved? Does the air feel cleaner, for example? So yeah, do post your answers in the chat. We'd be really keen to find out a little bit more. So that wraps up the housekeeping. So now let's make a start with today's session. You're stuck with me for a little longer as I'll now provide you with a brief introduction to Crossriver Partnership and our projects. So formed 26 years ago to build the Millennium Bridge across the River Thames, Crossriver Partnership is now delivering London's future together, with partners from local, regional and national tiers of government, businesses and the community. CRP is currently working to deliver a range of different projects. These are on your screens now. CRP would like to thank its major funders for making this LiveShare possible, central government units DEFRA and Innovate UK's Challenge Fund, as well as the Mayor of London. CRP is currently delivering a wide portfolio of projects. Our Healthy Streets Every Day project, for example, works across 17 London boroughs to allocate more street space for walking and cycling, creating a healthier place for those who live, work and visit London. And CRP's Clean Air Villages project is supporting hospitals, businesses and communities to keep London's air clean, ensuring continued support for these three key demographics as COVID restrictions are turned on and off. CRP's vision is to empower people to deliver innovative projects that support places to really survive and thrive. And for more than a decade now, we have ensured that clean air leads this approach. So some of you might have already seen this previously, but a recent study from Global Action Plan found that 70% of Londoners want the government and local authorities to tackle air pollution and traffic more urgently than before the coronavirus outbreak. Essential to this recovery is the promotion of clean and healthy commutes, switching to low pollution deliveries, helping customers choose low pollution options, create clean air workplaces, bring cleaner air to your neighbourhoods, and to normalise flexible working. In addition to working towards a reliable health recovery from COVID, we also want to support economic resilience in ways that benefit our wider environment. And it is possible to grow all three factors in tandem. Although having said all of this, it is imperative that this growth and resilience from COVID leaves nobody behind. Today, December the 10th, marks Human Rights Day, and the United Nations 2020 theme for this symbolic day is Recover Better and Stand Up for Human Rights. It is essential that we now work together to build back better and ensure that every single person has access to clean air. So I'd now like to welcome and invite Matt Towner, Portfolio Manager at Guys and St Thomas's charity, to speak more about the health effects of air quality, in addition to some of the projects they're working on to help protect and empower communities. So over to you, Matt.
Thanks, Thomas. So yeah, I'm a portfolio manager at Guys and St Thomas's charity. I work on a couple of our programs, childhood obesity and health effects of air pollution. And on the latter, I lead our work around engaging businesses. So Guys and St Thomas's charity, we are an independent place-based foundation. Our purpose is to improve the health of people living in London boroughs of Lambeth and Southwark, and we focus on tackling complex health issues that are prevalent locally, but which are also relevant to other urban areas across London, the UK, and internationally. We aim to address the major health challenges facing people living in urban, diverse and deprived areas. So we've got a real focus on health inequalities. And we aim to develop new approaches to health and share what we've learned with others so that they can learn and implement it in their places too. So implicit to that is we take a place-based approach, and what we try to do is support and layer interventions. So on lots of the issues that we tackle, we recognise that there isn't one single silver bullet to these issues. You need a series of different interventions coming at things from different angles, which are going to have an impact. And practically, that means that we work with lots of different partner types, from community groups through to large businesses like supermarkets, as well as local authorities and others. So as I alluded to, we take a programmatic approach to achieving impact. So we aim to focus on, or we do focus on, reducing childhood obesity, slowing down people's progression to multiple long-term conditions, addressing the health effects of air pollution, which is the relevant programme here, and preventing and supporting adolescent mental health issues. And what that sort of focused approach allows us to do is really understand each issue and try and understand the evidence base around the health need, around the solutions that exist to tackle that, and understand what our role can be in moving the dial on these issues. And on our programme to work, we have 3 stages which we go through. So to begin with, we start with the search phase, where we really try to understand the issue in depth, understand that evidence and local context is also key. And then once we've got once we've got that, that allows us to start developing some hypotheses around, okay, well, what is our role? What can we do to meaningfully impact here? And we move into the develop phase where we identify partners, we test our assumptions and share our thinking. And then the findings from that phase inform the rest of the sort of 10-year program. So the bulk of the program is this deliver phase where we try to launch partnerships, learn from our work, and share insights more broadly. And we're on this program. We're currently in the develop phase. So yes, this is it's a 10-year program, and we want to impact the health of those that are most affected by poor air quality, and I'll come to that in a bit. And yeah, we'll come at this, as I've alluded to, in lots of different ways. So why did we choose air pollution? Well, air pollution is key to some of the systemic causes of health inequalities in urban communities, and we know that the air is particularly polluted in city areas and indeed in our boroughs. So while poor air quality is increasingly in newspapers, in making the headlines, there's lots around spikes in air pollution, around health impacts. We feel, and the evidence reviews that we've conducted show that there's less known about what genuinely works to reduce the impact of air pollution on people's health. So many of you might know this already, but there are three main pollutants associated with poor health in inner cities. Firstly, nitrogen dioxide, really associated with vehicle traffic most strongly. Particulate matter is and then of different sizes, so PM2.5 and PM10 is a sort of crude division. And those particulate matter can be comprised of lots of different types of material, from soot, smoke, dust, and liquid droplets. And all three of these are associated with, the onset of new health conditions or the worsening of existing health conditions and increased hospitalizations. So, for example, those with heart and lung conditions or those with asthma are particularly badly affected. And this slide gives an example of how we use data and local understanding of our boroughs to inform our work, and indeed sort of create a compelling case for change, we hope, more broadly. So you'll see on the left that the entire footprint of our boroughs of Lambeth and Southwark exceed WHO guidelines for particulate matter. And then in the middle, we highlight where some of the populations that are most badly affected by air pollution live, so children, people with heart and lung conditions, and older people. And then we think that that air pollution has the biggest impact on people's health where there are both high levels of exposure and a high proportion of susceptible people. So what we look to do, and we'll do over the course of the next few years, is target our work where we think it can have the biggest impact, at least where solutions can be targeted and localized in that way. And so to address air pollution, understanding where it comes from is clearly an important part of the equation. And so here we list the sources of PM2.5 and nitrogen dioxide, and you'll see things like road transport, both in terms of personal transport, public transport, but also freight play a really important role, as well as things like cooking and wood burning. And what I'd also say is actually, if you take into account PM10, construction becomes a really important source of poor air quality locally, both in terms of the dust that's emitted from site, the exhaust emissions from lorries and machinery on site, as well as the plant machinery that's used. And critically for us, air pollution is a driver of health inequalities and a social justice issue. And we see these inequalities as being threefold. So firstly, those impacted by air pollution are least likely to contribute to it. They don't own a car or a wood burner. Secondly, those most impacted by air pollution are more likely to be negatively impacted by other determinants of health, such as unemployment or systemic racism. And thirdly, our evidence suggests that those most impacted by air pollution are less likely to be engaged or heard in decisions to address air pollution. So I was asked today to speak about what works to address air pollution, and well, clearly this is going to be a big focus of ours, or the big focus of ours over the coming years. We have commissioned a couple of evidence reviews here. So the first was commissioned or conducted by the Environmental Research Group, now based at Imperial, and this found that few interventions identified assessed the effect on air quality, and even fewer considered the impact on public health. So what this tells us is that evaluation is underfunded in this space. And while there's lots of really promising activity and initiatives, we see a role for ourselves in helping to build the evidence base, and we'd welcome obviously efforts by others to do the same. That said, there are lots of examples where positive impacts have been achieved, and it's reasonable to assume that shifting someone from driving a car to riding a bike is an improvement. And so there are various examples of this. The report also identified a number of promising avenues for us to look at. So unsurprisingly, reducing emissions at source is a key tactic that we need to use. And secondly, targeting vulnerable people with behavioural interventions. And I'll speak a bit more about how the evidence base might shape how we might do that. And secondly, and then sort of lastly, a number of key evidence gaps were also identified. Indoor air pollution is a really critical one here. And secondly, air quality in population centres like hospitals and nurseries. So if we want to protect those vulnerable groups, we need to be mindful of where they spend their time. And so hospitals, nurseries, schools are really important to that equation. And I wanted to pull out a few specific examples of what works or doesn't, and you'll see that the sort of middle column I've weighted in the sense that this is indicative of the evidence base more broadly, where there's either evidence of solutions having mixed impacts, where they are good in some respects and less good in others, or where actually the evidence base isn't quite strong enough yet. And that's typical. So a couple of examples of things that really don't work: road coatings, street sweeping and cleaning. In real world conditions, these were found to be ineffective. Whereas things like delivery consolidation schemes, so looking at the number of deliveries that are taking place, where they're taking place, the timing of those sorts of schemes can be really effective, and they're increasingly common in the hospital trust are using them in our boroughs, as well as the construction industry is increasingly using these too. Secondly, NRMM or plant machinery policies. The GLA has a low emission zone here, which regulates the type of machinery that's used on on construction sites, on roadworks, etc., and is particularly strict in pollution hotspots in the middle of the city. These have been again shown to be really effective. And finally, low emission bus zones. So one study in Brixton showed that the new technology reduced nitrogen dioxide emissions from the higher grade buses by around 89%, though there are caveats around sort of when that works less well, such as in congestion. Some things with mixed impact. I mean, electric vehicles, I think they're overwhelmingly positive, including from a carbon perspective. There are some concerns around the particulate matter still emitted from brake and tyre wear. Things like tree planting, can be effective. It just really depends. The evidence review found it really depends on how you do it, the species of trees used, the spatial distribution. Though it was clear that creating green spaces away from pollution sources can create low exposure areas for the public. Things like green screens, again, they have mixed impact. They divert air pollution, but don't reduce it. Obviously, there's more need for health assessment follow-ups to be conducted, and things like low emission neighbourhoods and smarter driver training too, mixed impacts. And on the latter, we really like to see behavioural insights applied to see how training can be supplemented to improve the outcomes from this type of work. And then the second evidence review we commissioned was by Behavioural Insights team, and there they looked at particularly two types of work. So modal shifts and how you shift people from away from car usage, and then secondly interventions to reduce exposure to outdoor air pollution hotspots. And a critical finding here is that is common to behavioural insights, is that interventions should ideally alter people's environment to reduce the need for individual behaviour change. Information and training alone generally aren't enough, and this is because they can increase intention to change your behaviour, but often there are other barriers that get in the way of you being able to do that. So for example, on this modal shift question, changes to built environment, changes to public transport and how accessible it is, how cheap it is in terms of incentives and financial incentives have an impact. Car sharing, a really practical scheme that allowed people to travel together, they all had clear evidence of impact, and they sort of obviously go beyond information sharing. Whereas on the reducing exposure front, low exposure walkways again and cycle paths are most proven. And so I suppose these are counterpoints to sort of things like cycling training alone, which might not achieve the same impacts if not supplemented by these wider interventions. And what it found again is that more evaluation is required for lots of different types of interventions that we'll be working with, and others here will be working with, such as digital air pollution maps and route finders, on-street signage and alerts. So lots of really promising activity, but again a bit of evaluation is needed. So I think what I wanted to show here was just how all these things come together to inform how we approach this. And so just quickly, over the sort of coming months, we'll be focusing on creating a compelling case for change by generating high quality evidence and using different types of data. We'll be engaging and amplifying the voices of those most impacted. We'll be reducing exposure to air pollution in the environments where people spend their time. And we'll be trying to work with businesses to find equitable solutions to reducing emissions. And yeah, there's a couple of examples of our work here. So I'll let you guys read this, and I'll stop speaking there and happy to take any questions.
Brilliant. Thank you very much, Matt. Yes, a great overview of the health effects of air quality and also some of the interventions that work to reduce pollution. So we've got some time for a bit of a Q&A session. Do feel free to post your questions in the chat, attendees. Any questions for Matt, post them in there and I'll ask them to him. And just to respond to you, Julie, yes, the presentations will be available afterwards. And there's also a recording which will be made available as well. So brilliant. So I'll kick off then with the first question. So you mentioned, Matt, that air pollution is a driver of health inequalities and social justice issue, stating that evidence suggests those most impacted by air pollution are less likely to be engaged with or heard in decisions to address air pollution. How can the voices of those whom are most impacted by poor air quality be better heard in order to address the social injustice?
Thanks, Thomas. So yeah, this is something we'll be exploring over the coming year. And specifically, we're working with a team of community researchers, which we've recruited from local communities that are trying to understand why these communities are less well represented. And we'll be sharing insights early in 2021. We also think that there are some really great local organisations that are campaigning on this issue. So from Mums to Lungs to Advocacy Academy's Choked Up campaign, and so we'll be listening to those voices, and would support others for doing the same.
Well, thank you. So maybe that leads on to another question then. So how are you involving your hospital and visitor communities as part of your strategy to help deliver your 10-year programme to reduce air pollution?
Yeah, so we I guess it's worth saying firstly that there's actually there's some really good work that's already underway on the trust side of things. So for example, they've created a consolidation centre based in Dartford for their supply chain, which really looks to limit the amount of deliveries coming in and out of the hospitals themselves, and then impacting on local traffic as well, which is great. And then secondly, they've been working with cargo bikes to replace vans and motorbikes transporting blood and tumours for testing between the hospitals. So there's some really, really exciting work going on already. What we recognise is that I think it's 5 out of 10 hospitals in Lambeth and Southwark are in areas where PM 2.5 is 50% higher than WHO recommendations, and so we think there's more that we can be doing with working with GSTT, and we are funding an air quality manager's staff time to explore what else can be done, including looking further at supply chain impacts.
Brilliant. Thanks, Matt. We have had a few questions in through the chat, so thank you for posting those, both Holly and Aidan. So we'll start with Holly's question then. So Holly's from the charity Living Streets, and she says that you mentioned behaviour change initiatives, or the built environment change investments will be the most important to encouraging modal shift. Sorry, I haven't read this question very well. I'll reread. Would you say behaviour change initiatives or built environment change or investments will be most important to encouraging the modal shift that is needed to fight air pollution? That's better. Sorry, Matt.
So I'll cheat in that I'll say that both are important. I think what the evidence review was telling us is that as much as possible, supplementing behavioural change interventions with changes to things like the built environment, or sort of other interventions to overcome other barriers that people might face. So for example, public transport being too expensive is a really obvious one, where you can try and lower the price of that and try and encourage people onto public transport and away from cars. That's really important. So yes, try and do them both. The evidence is saying try and do them both together. And I guess the only other thing I'd say is, as well as I suppose we also have to be pragmatic in that sometimes the changes to the built environment are harder to make and more expensive to make. So it's definitely worth considering on a case by case basis as well.
Brilliant. Yeah. So a mixture of the both. Brilliant. Okay, so we've got one other question from Aidan. So thank you, Aidan. So Aidan would be interested to see the evidence behind your what works. So what changes have been seen from introductions of low emission zone policies and bus zones?
Yeah, so it's a really good question. So I think on the low emission zones, there is some sort of promising evidence, and so I think it found that they can on low emission neighbourhoods, they can be an effective method of reducing emissions and exposure to air pollution, but monitoring is inconclusive, and again, sort of more evaluation is needed. Low emission bus zones, they looked at emissions from buses on those routes where either the buses have been retrofitted or where buses have been replaced with newer ones, and there the evidence is clearer that they work. And I'm happy to sort of follow up with Aidan more directly with a bit more detail afterwards, if that's helpful.
Brilliant. Thank you very much, Matt. Okay, so I think what we'll do now then, we'll we'll move on, but thank you very much, Matt, for a great talk and for answering the questions. And we'll come back to you just at the end for some final discussion, for a final discussion and observation point. So thank you very much, Matt.
Sure.
Brilliant. So we'll now move over then. I'll just move the slides forward. Brilliant. So we'll now then move over to both Grant Waters and Ben Warren from Tranquil City and Abby McDougall from CRP's Clean Air Villages 3 programme. So Grant, Ben and Abby will be talking about some of the monitoring work that's being undertaken as part of the Clean Air Villages 3 programme that is enabling access to clean air for communities, visitors and businesses. So over to you all.
Thank you, Thomas. I'm going to start. So I've chosen to start with this figure, and this is, you might be aware, the number of Londoners estimated to die each year as a result of poor air quality. So it's quite a solemn way to start a talk, I'm aware, but things will pick up, I promise. As I said, you're no doubt familiar with this figure as it's widely reported, but it is just a number and it's quite hard to put into context. So it's the equivalent of 180 deaths per week just in London. But probably until this year, perhaps with COVID, even this figure is quite hard to relate to. A report from King's College, which attempted to personalise the impact. I can hear something say, is there no sound? Can everyone hear me?
Yeah, we can hear you, Abby.
Okay. I'll continue, shall I?
Yes, do continue, and I'll answer the query in the chat.
Okie dokie. Yes, a report from King's College, which attempted to personalise the impacts of air pollution and contains, unsurprisingly, a whole host of fairly gloomy stats, states that on days where air pollution is high compared to days where it's low, an extra 74 children are hospitalised with asthma in London. Now, whichever of these stats resonates with you the most, I just thought it was important to take a moment to remind ourselves why we do care about air pollution and why we simply have to make things better. But that said, it's not all bad news. And the Mayor published a report this autumn, which outlined that in 2016, 455 state primary and secondary schools were located in areas exceeding legal limits for nitrogen dioxide. Now, in 2019, this had dropped to just 14 schools, which is a huge reduction of 97%. So air quality is on the whole improving across London, and we're seeing evidence of this, which should certainly encourage us, but we mustn't take our eye off the ball or our feet off the bike pedals. There is still a long way to go, with 99% of London still exceeding WHO recommended limits for particulate matter, and 24% of roads in inner London still exceeding the UK legal limits for nitrogen dioxide. So it's undeniable that we need to continue to see strong action and leadership on a national, regional and local level. But it's not just about politicians and councillors. And as part of the Clean Air Villages programme this year, we wanted to empower communities and individuals to be aware of what they can do right now to reduce their exposure. And if I may generalise for a second, one thing we all do every day when we're not quarantining or isolating is try to get about this wonderful city of ours. Now, I know that I would figuratively and literally be lost without the apps that I use on my phone. I don't really go anywhere without plotting my start and end destination into an app, and I assume that I won't be alone on this. However, these apps, as great as they are, they do have their problems. That being that we become reliant and therefore skewed towards the routes that their algorithms choose. And these typically prioritize, if not exclusively focus on, getting from A to B in the fastest possible time, which sounds great, but this does have its trade-offs, and they often guide us along main routes with high motor traffic. You can take the example that you've got on your screen. Here, we're trying to walk from Tottenham Court Road station to Piccadilly Circus station. Now, the likes of City Mapper or Google Maps will direct you down Charing Cross Road and along Shaftesbury Avenue. But if we overlay this with modelled nitrogen dioxide levels, we can see that we're being directed along streets where we expect the levels of pollution to be the highest, these ones in the purple on your screen. And this result is unfortunately not unique to the route that I've chosen here, and it happens all the time due to the fact that these apps are not built to consider our exposure to pollution. So there are alternatives to your typical Google Maps which do account for air quality. So at this point, I've got to flag up the CRP's Clean Air Route Finder, but we've covered this in an earlier LiveShare. So all I'll say is, if you haven't tried our route finder, do go and check it out, but I won't dwell on it for too much longer. All I'll say is that while the emergence of these alternative route finders is great news, they can only do so much for now at least. And what they can't take into account are certain aspects of what it actually feels like to be on a given street. Our streets and our urban spaces are complex places, and we all have slightly different things that we want and need from them. For example, how noisy is it? How much green space is there? How wide are the pavements? And is it actually pleasant to be on that street? Now, drawing conclusions about these things, and more importantly, perhaps balancing between them, does take some human input. And this is what we've tried to do with the support from Tranquil City and the partners, of which some of you may be on the call from the Clean Air Villages project. We started by considering a whole host of things, primarily levels of pollution, but also proximity to parks, finding streets that aren't too crowded, accessibility for those using a wheelchair, all while trying to make sure that the journey time stays as low as possible. And we've attempted to balance these concerns to develop new clean air walking routes. But in order to classify them as truly clean air routes, we commissioned Tranquil City to undertake some real-world monitoring to back that up. And at this point, it's my pleasure to hand over to Grant from Tranquil City to talk about what they did next. Over to you.
Thanks, Abby. Lovely introduction. So it'll be myself and Ben who are presenting on behalf of Tranquil City today. So we're an organisation whose mission is to provide empowering and actionable data on environmental quality. And also we hypothesize that with given the right information, we can all make healthier choices for ourselves and our loved ones. So myself and Ben lead the team. Ben is an experienced air quality consultant and I am an acoustician. Our team is much larger, with a team of experts and advisors ranging from other disciplines, including sustainability, environmental psychology, data science, urban planning, and public engagement. So we make understanding environmental data accessible for everyone. We curate multiple data sets from different disciplines, as well as measurement data, and create digital tools to help that data be used in a wide variety of ways, whether that's in apps, as Abby suggests, or websites that we commonly use, public engagement tools, or for research. A key area of our work is how our mobility decisions can be influenced by environmental quality and how much of an impact that can have on our daily life and health and well-being. So how can we get from A to B whilst making a healthy choice as well? We know firsthand that data and digital technologies can't drive this change alone, as Matt was indicating. It usually takes a number of both physical interventions, behaviour change from potential technologies, and also behaviour change encouragement from engagement events. So we began exploring what urban tranquility meant for us, and this is how Tranquil City began in 2016 through the hashtag Tranquil City London, where we asked people the question, where do they feel tranquil in London, and how do we emphasise and promote and celebrate these spaces to look at the city from a more positive perspective. So we've co-created all of our solutions with the public, and we continue to do so. And we run public events to explore the city from a more tranquil perspective, creating tranquil routes, helping people notice and connect with nature and their surroundings, as well as encouraging people and ourselves to take some time out from our everyday lives. So this project aligns with our goals of promoting positive behaviour change towards healthier cities and lives. And the specific challenges for this project were to accurately monitor the most relevant pollutants to human health, to present the air quality benefits in a way that is easily understandable, engaging, and encourages people to use the routes, and to further encourage route uptake by addressing and promoting other environmental and streetscape factors that can impact our willingness to walk or cycle routes. So that first question, which pollutants did we measure? For this project, we wanted to measure the pollutants of the highest regulatory concern in London, and the ones that are most representative of road traffic related pollution levels and associated health impacts are nitrogen dioxide, particulate matter 2.5 and 10. However, this presented a challenge. These pollutants are tricky to measure consistently with portable air quality monitors. So we had to explore monitors on the market that were capable of measuring pollution accurately along the two routes simultaneously, and also combine this with a methodology that will ensure reliable results are captured. So we chose to use the Tranquil Series 500 monitors, which have specific sensor heads for different pollutants. An air quality sensor performance and evaluation center in the US rated them as having good performance for NO2. And in order to monitor NO2 accurately, ozone was also needed to be measured and subtracted from the sensor head for measuring NO2, its readings in post-processing. So the monitors measure 1 minute samples, and this allowed us to measure simultaneously the routes using two sets of monitors and the change in concentration along those routes. We also took the PM2.5 and PM10 measurement head, which you can see on the right as our monitor number 5. So our survey approach, this lovely diagram here, shows us how we conducted multiple runs of each of the route pairs, measuring NO2 and ozone simultaneously across routes. So myself and Ben were doing the monitoring, which we very much enjoyed, and Ben will talk about that in a second. But it allowed us to, this method allows us to run each route 6 times to ensure that we had good averages, and we could also highlight any erroneous results that may be due to sort of discrete transient factors, which we noted along the way. So I'll just hand over to Ben, who'll talk more about the monitoring itself and also the results.
Thanks, Grant. So we undertook the monitoring in October. We did this in the morning and evening peak periods. So it meant a lot of early starts to get into different places in London, to start at 7 o'clock usually. But we did find those, that was a challenge in some senses, but we found it really interesting, and it's quite a nice experience to see London waking up in the morning like that. So I think overall we did enjoy doing the surveys and discovering different parts of London, which I think is one of the main benefits of walking and cycling around, is really feeling a connection to London as well. So when we had done the monitoring, we had to have to go through steps of processing the data. These main steps are listed here, so downloading the data. As Grant mentioned, we monitored ozone and NO2 simultaneously so that we could correct the results, because the monitors can cross-read ozone. The NO2 monitors can cross-read ozone, so we needed to subtract that to get a final NO2 concentration. We also did co-location at the end of each individual route pair on a survey to check whether the monitors were giving comparable readings, so that we could directly compare the results from both of them. In most cases, the monitors did produce very comparable results with no consistent under or over reading of one of the monitors against another monitor. In some cases, this did happen, so we corrected the results to make sure that the values achieved at those co-location points were equivalent, so that we can compare the results directly. Where there were consistent differences, we think it might be something to do with temperature or humidity. Those are typically things that affect nitrogen dioxide readings, and particularly readings from handheld sensors. and we were able to map the results, as you can see here, using the location data that we collected on the surveys using Strava. So we were just recording the walking that we were doing so that you could see where we were at each time a reading was taken. So the overarching results are provided in this table. Obviously the numbers are quite small. They're all detailed in the report that I'm sure will be available on the CRP website when that's finalised. But the overarching results was that there were clear benefits in nitrogen dioxide exposure of taking the clean air walking route. The average benefit on the repeat simultaneous walks on a particular survey was up to 23%, and the maximum benefit of a particular walking pair was 41% for nitrogen dioxide. So yeah, the clean air walking routes have a real benefit in your exposure to nitrogen dioxide. The next slides show some illustrative examples that we wanted to provide of this. So the first one is the first walk that we did at Richmond. The average benefit across the 6 routes that we did was 23% less or lower exposure to nitrogen dioxide, and the maximum for one of the routes or one of the walking pairs was 30%. And you can see this shows the higher concentrations around the station on the road called the Quadrant, with higher concentrations there, and you can really reduce your exposure by taking a route which is only a little bit longer by going through Richmond Green. Deptford is the next one. Again, there's clearly much lower exposure to nitrogen dioxide by going through Fordham Park as opposed to New Cross Road. That stays busy throughout the day with sort of peak areas around traffic lights and things like that. And the next one is Wimbledon, where there was an average benefit of 23% and a maximum on a particular routed pair of 41%. So this one didn't go through a park in particular, but it showed the benefits of going through residential streets away from the high street. And in particular with this year and the challenges that we've all faced, it's can be quite a good. It demonstrates that you can sort of achieve social distancing by going along those residential streets if you potentially wanted to avoid a busy high street. So going on to talk about particulate matter, which was monitored as well. The results were much less conclusive for particulate matter for both PM10 and PM2.5. And this is because the monitored concentrations were very low on a lot of surveys, as you can see here in Richmond in the graphs at the side. For both the clean air walking route and the standard route, the concentrations stayed very low and there were lots of 0 readings. This meant that any particular incidence of a single peak of pollution, like, for example, passing an idling lorry, which happened a couple of times, that caused a peak in pollution. And if that occurred on the clean air walking route, then because a single incidence like that had the potential to make the clean air walking route look worse than the standard route. That said, for another example, on Seven Sisters, where the pollution levels were higher, where there was a lot of queuing traffic in this particular survey, there were benefits of the clean air walking route. In this case, PM10 exposure was 40% lower on the clean air walking route. And we do know from modelling carried out for the London atmospheric emissions inventory, carried out by King's College London, that particulate matter exposure is lower on the clean air walking routes than on the traditional routes on busy roads. Particulate matter is definitely comes from exhausts from vehicles, and now even more importantly than the exhausts, brake and tyre wear and road abrasion, as mentioned before, are also really important sources of pollution. I'll hand back to Grant.
Oh, I skipped ahead. So other environmental benefits is what we also did because we understand that air pollution is one factor that we consider when choosing routes, and also as an impact on our health. So using our Tranquil City database, we calculated the further environmental benefits that the clean air routes provided. So based on DEFRA EU noise directive levels, the modelling, most clean air routes showed a notable reduction in average noise level compared to the regular route. Generally, just for everyone's information, a reduction of 10 decibels is perceived as a halving of the sound level. And a lot of routes showed over 10 dB reduction. This one in particular, in Shepherd's Bush, showed a difference of a reduction of 15 dB. So this will significantly improve the experience of a route from a soundscape perspective, but also some of the routes showed up to 28% more greenery and up to 10% more tree cover. And exposure to natural elements has also been shown to significantly boost our well-being. And with these reduced noise levels, the sounds of birdsong and other natural elements such as flowing water, if we're passing water elements, also become more noticeable, which also have been shown to provide restorative qualities and facilitate higher increased well-being. So we've also measured the routes against our new Healthy Streets Index, and it's the first London-wide data set of its kind, which we created in partnership with Healthy Streets and University College London. And the clean air walking routes that were created were up to sort of 14% higher in Healthy Streets Index performance compared to the regular routes. So in conclusion, the average nitrogen oxide benefit for clean air walking routes ranged from 6% up to 23%, and the maximum NO2 benefit for particular route pair walks was up to 30 to 40% increase or benefit, sorry. So due to low levels of particulate matter, results were not conclusive, but it is considered that particulate matter, based on modelling examples from the clean air routes, is lower. So reductions in air pollution exposure alone is not sufficient to encourage sustained behaviour change, however, towards walking and cycling, but environmental and street quality comparisons were made, and routes showed notable benefits in other environmental and streetscapes quality, such as pavement width, pavement quality, drop curbs, and obviously the other environmental factors we just described. So we'll hand over back to Abby to make some closing statements.
Thank you, just unmuting. Given the time, I'm just going to do a really quick, it's just a practical note to say this is sort of the timeline of the Clean Air Walking Routes project. We're here in December with the LiveShare. We hope to be able to publish the final report and make that available to you all before Christmas. And then wider promotion, of which we've got various different things planned, will kick off from January onwards. Yeah, we can hand back over to you, Thomas. I'll skip the last bit so that we have time for questions.
Excellent. Thank you, Abby, and Grant and Ben. Yeah, such a great outline there for the work you've been doing. This is really great to see. Okay, then we've got some time for some questions. We've got a question from Julie, and I think that's directed to you, Abby. Would you just be able to remind us of the annual number of deaths and frequency or number of child hospital admissions, the figures you mentioned at the start of the presentation?
Yeah, of course. The figures I mentioned, the first one was 9,400. I don't know if I can go back to the slides. That's the estimated number of Londoners to die each year as a result of poor air quality. And then I went to 180 per week. And then it was just a stat about on days of high air pollution versus those with the low. It's estimated that an extra 74 children are hospitalised with asthma in London. I can share links with the reports that those came from. I think mostly the Environment Research Group at Imperial College are responsible for those.
Good. Yes, it's hard to get your head around those things, isn't it? Thanks, Abby. Yeah, and the slides will be available anyway and sent to you all tomorrow, so those stats will be in there. Okay then. So do feel free to post your questions into the chat, audience. We've got a few minutes. But maybe let's make a start then, and maybe this is a question again for you, Abby. Who is the target audience for these clean air walking routes? Is it primarily local authorities, or can residents and businesses also use them?
Yes, I guess we haven't really mentioned too much about the audiences, and probably because it varies from route to route. The simple answer, and possibly a cop-out, would be to say that they're intended for everyone. But there are nuances. So we've got about 4 or 5 routes that are going to and from hospitals, of which St Thomas's is one of them. And so then the audience there would be very much more the staff, visitors, patients visiting those hospitals. Then comparing that, we've also got a few routes like the one that we've developed with the City of London, which goes between Monument up to Liverpool Street Station. And rather than going along, I think, is it Bishopsgate, the main road, sort of taking a more meandering and interesting route through quieter, quainter, more interesting streets. And that would be much more for visitors, tourists. I know it might not seem very applicable at the moment, but we're hoping that visitors and tourists will return to the area. And so the audiences were obviously quite different between those two kinds of routes. So short answer for everyone, longer answer that it does vary from route to route.
Excellent. Thank you, Abby. We've got time for about one more question, and I think this time we'll direct it to both Grant and Ben. Yeah, sorry, I can see that we've got another question actually from Barbara. So we'll go for that one as well, so we answer all of our audience's questions today. So Barbara's asking, does this mean that the routes are limited, Abby, from your question there?
Just help me out. Limited in what sense?
Barbara, would you be able to ask Abby's question in the chat, and maybe Abby, if you could answer Barbara in the chat, that would be brilliant. And then I'll ask my original question to both Grant and Ben. Brilliant. So you mentioned at the beginning of the presentation that the streets, obviously, they differ. Are all the clean air walking routes fully accessible for all? And do those routes maybe incorporate all or most of Lucy Saunders's Healthy Streets indicators, for example?
Yes, so that's a good question. We have strived to do our best to make sure that we check all the routes prior to the monitoring while they're being created, to make sure that there's wide pavements, drop curbs, crossings along all of these alternative routes. So we actually went out onto site to check those. So that was in addition to what we did getting up in the morning and doing the evening sort of sessions monitoring. We thought that was really important, just to make sure that we're aware of the local environment, not just necessarily using data. But we did also use, as we said, about the Healthy Streets Index and noise data, air quality model data, as well as information on street width. That we've combined and is a part of the Healthy Streets Index data set to hopefully look at a high level and make sure that the routes are as widely accessible as we can do. So we have done our best to make them as accessible as possible, which we feel really confident that they are.
Brilliant. Thank you very much, Grant. So perfect. So that leaves us with some good time left, and we'll move to the final discussion question then. So thank you all for your presentations, Ben, Grant, Abby, and Matt. I hope all of you in the audience have found them useful and have provided us with some further insight on how we can all work towards ensuring cleaner air for all. So I'd now like to pose a question to our speakers, and that question being, what key actions would you give to community members listening in today to help them reduce their contribution to poor air quality? So I know that we've mentioned many different interventions and behavioural changes that people can adopt, but what would be the key one that you would recommend for a community member to take forward? Let's go in reverse order of those who presented, about 20 seconds each, because we've got about a minute left. So if we start with you, Abby.
Yes, of course. Sorry, Barbara, I will get back to you. Yes, I don't necessarily have something groundbreaking, but given that it's the season to be ordering online, I would definitely advise people to consider how their parcels are arriving at their door and try to take simple steps to mitigate the damage that this can have, whether that's shopping locally or using click and collect, or searching for suppliers who offer green deliveries, or just trying to consolidate your orders by finding one store that might sell 3 or 4 of the things that you're after. I think just remembering that every little does actually help, and let that empower you. And I guess don't be shy to talk to your friends, family and neighbours about that too. That would be what I would say.
Brilliant. Thank you, Abby. Should we move across to you, Grant?
Yeah, thank you. So I think the one thing that always sticks in my mind when we do our engagement events is to encourage people to really take notice of their environment, and that can obviously include air quality, but it's a bit difficult to perceive. But there's other indicators that can also be a proxy for air quality, such as noise. If you can hear cars, if you can hear sources of pollution that you know exist, use them as indicators to hopefully find potentially healthier spaces around you. So I always encourage people to try and take notice of that and make small changes in their activities to make themselves and hopefully the ones that they're spending time with feel better.
Brilliant. Thank you very much, Grant. Across to you, Ben.
Yeah, we talked a lot about behavioural change and moving to walking and cycling, and I think people focus on that a lot because it's seen as quite a possible thing that can be done, because I think studies show that something like 40% of vehicle movements are from journeys in London are for 1 or 2 kilometres or something like that. So I'd say think about whether you need to use your car for short journeys. Could you walk or cycle? If you can, it's better for your health and well-being, your wallet, and the health and well-being of people around you and the city in general.
Absolutely. Thank you, Ben. And then finally, across to you, Matt.
Cool. I think one that often gets missed is if you do have a wood-burning stove, try and use it less. I mean, I know it's Christmas, and I'm sure some people will want to use it at least on Christmas Day, but overall, we'd recommend using those less.
Absolutely. Thank you very much, Matt. Well, brilliant. Great comments there from everyone. Thank you all. So, Pivot, I know that we're running quite short on time, but just a few final words then. So we would like to point you into the direction of our next live share session, which will be on Thursday, December the 17th at the same time, 2 p.m. The topic of the session will be looking at the future functionality and potential of London centres. Please do join us for this, and the Eventbrite is being posted in the chat now. So please do sign up. And then finally, before you all go about the rest of your afternoons, I would like to remind you all to sign up to our newsletter and follow us on Twitter and LinkedIn to receive all of our latest updates here at CRP and upcoming live share sessions. A registration link to our next event will also be publicised via these platforms, so do keep an eye out if you can't register today. This live share, past live shares, and all of our future live shares will be posted on our YouTube channel for you to view whenever you want and also share with whoever you want. And any questions you have, as always, please don't hesitate to get in contact with any one of us. Our contact details out on your screens now. Well, I'd like to thank all of our speakers today for some really thought-provoking and insightful presentations, and a big thank you to everyone for tuning in and joining us this afternoon. So remember to stay safe, and see you all again very soon. Goodbye.
Thanks, Thomas.
Thank you, everyone.
Thank you.
Thanks, everyone.